Doctor, welcome to Africa Live. Thank you for taking time to speak to us. Now, the high cost of HIV drugs has been a major hindrance to access to medication in Africa. How significant is this deal for countries with a big HIV/AIDS burden?
Good afternoon, and thank you for having me. This is a really landmark deal for most of the global South countries that really face the brand of HIV. If you look at the journey we have taken with HIV and really trying to make sure that we eradicate the disease, this is a significant step. Number one, not only from a cost perspective, but also from a usage perspective, because it brings in and reduces the burden of our patients, clients from really accessing tablets and having them on a daily basis, coming to facilities to get tablets on a monthly basis. And so this is huge. If you look at it, cost from buying the drugs themselves, and also cost that's related to accessing the drugs for the clients that we see. So really a significant and very important day for all of us in the global health space, and for everyone involved in making sure that we make HIV a historical disease.
All right, Dr. Cabotegravir is an injectable drug. Highlight and illuminate, if you will, other advantages over the oral HIV treatments available.
Yeah, thank you. As I already mentioned, I think most, if you look at HIV prevention, we need to be aware that the people that we're talking about are people that are not sick. These are individuals that are healthy and trying to take prevention against HIV. And so it's always important to be aware of that. And it's very difficult, especially where one has to be taking pills on a daily basis whilst they're not ill. It poses a huge challenge. So the big advantage is that then the pill burden for our clients is reduced. The clients have to take the injection about once in every 2 months, which makes it much easier for them in terms of their need to adhere to the injection. Number two, it is very important. Again, there is a lot of stigma out there. We've had HIV for a long time, but we continue to see stigma associated with HIV. And one of the challenges that we faced is that PrEP itself, in the oral form, has previously been associated with someone taking ARVs for treatment. And you see, so in some populations, we face difficulties to encourage people to take PrEP, because then when they go out in the society and communities, they're viewed as people that are HIV positive. Now, the injectable, because it's once every 2 months, it kind of removes that aspect of the challenge that we face with the oral PrEP. Thirdly, I think if you look generally at comparison between injectables and oral PrEP, there are opportunities in integrating the injectable with other services, for example, sexual and reproductive health services, where there are opportunities that this can be combined, and the clients don't have to really come to a facility multiple times. And so reducing the costs related with travel, accessing facilities, and all those associated with traveling to facilities.
All right, Dr. Albert, let's leave it there. Thank you so much for speaking to us here on Africa Live. Much appreciated.